The 5 most evil psychologists in history. Psychology, as a discipline, has been instrumental in helping us understand human behavior, mental processes, and the overall intricacies of the human mind. It has provided us with valuable insights and therapeutic methods that have improved the lives of countless individuals. However, as with any discipline, there have been instances where some psychologists have misused their knowledge and skills, causing harm and suffering to the very people they were supposed to help. This video delves into the lives and work of 5 psychologists who have left a dark mark on the history of psychology due to their unethical actions and malicious intent. 1. Dr. Henry Cotton, 1876–1933. Dr. Henry Cotton is infamous for his grotesque treatments at the Trenton State Hospital in New Jersey, where he worked as the medical director from 1907 to 1930. Driven by a strong belief that mental illness was caused by infections, he subjected patients to a series of horrific surgical procedures, which he referred to as surgical bacteriology. His patients were subjected to unnecessary surgeries, such as tooth extractions, removal of tonsils, and even removal of organs like the stomach, colon, and spleen, all in the name of curing their mental illnesses. Cotton's procedures led to the death of numerous patients, with some estimates suggesting a mortality rate of 30% to 45%. Despite the significant death toll and the lack of evidence supporting his theory, Cotton persisted in his cruel practices, leaving behind a legacy of pain and suffering. 2. Dr. Walter Freeman, 1895–1972. Dr. Walter Freeman is known for popularizing the lobotomy, a now infamous surgical procedure that involved severing the connections between the prefrontal cortex and the rest of the brain. Initially, the procedure was seen as a promising treatment for severe mental illness, particularly for patients who did not respond to other treatments. However, Freeman's enthusiasm for the procedure led him to perform lobotomies on a massive scale, often with little regard for the patient's well-being. He was known to use an ice pick-like instrument, called an orbitoclast, which he inserted through the patient's eye socket to sever the connections in the brain. His ice pick lobotomies were performed on thousands of patients, many of whom suffered severe brain damage, loss of personality, and lifelong disability as a result. Freeman's cavalier attitude towards the procedure and his disregard for the devastating consequences it had on his patients make him one of the most evil psychologists in history. 3. Dr. Ewen Cameron, 1901–1967. Dr. Ewen Cameron, a Scottish-born psychiatrist, was the president of both the American Psychopathological Association and the Canadian Psychiatric Association. However, his seemingly impressive credentials do not overshadow the dark deeds he committed during his tenure as the director of the Allen Memorial Institute in Montreal, Canada. Cameron conducted a series of unethical experiments, collectively known as the Montreal Experiments, funded by the CIA as part of the MKUltra project. His experiments aimed to pattern the human mind, erasing memories and personality traits to make individuals more susceptible to reprogramming. To achieve this, Cameron subjected his patients to electroconvulsive therapy, ECT, at 30 to 40 times the normal intensity, prolonged sensory deprivation, drug-induced comas, and the administration of powerful hallucinogens like LSD. His psychic driving technique involved playing repetitive messages to patients for days on end to reprogram their minds. The majority of Cameron's patients were not informed about the true nature of the experiments, and many experienced lifelong psychological trauma as a result of his unethical practices. Some even committed suicide due to the irreversible damage inflicted upon them. Cameron's sinister experiments and his flagrant disregard for the welfare of his patients make him one of the most evil psychologists in history. 4. Dr. John C. Lilly, 1915–2001. Dr. John C. Lilly was an American physician, neuroscientist, and inventor who made significant contributions to the fields of neurophysiology and interspecies communication. While some of his work was groundbreaking, he is also remembered for his unethical and cruel experiments on animals, particularly dolphins. Lilly's research on dolphins included attempts to teach them human language and establish a means of communication between humans and cetaceans. However, his methods were often inhumane and cruel. In one of his most infamous experiments, Lilly isolated a dolphin named Peter in a partially flooded house for months, subjecting the animal to sensory deprivation and confinement in an unnatural environment. In another experiment, Lilly administered LSD to dolphins in an attempt to enhance their communication abilities. His experiments on dolphins were not only cruel but also scientifically unsound, as they were based on flawed assumptions about the animal's cognitive abilities and communication systems. Lilly's treatment of animals in his research, combined with his use of dangerous hallucinogenic drugs, makes him one of the most evil psychologists in history. 5. Dr. Phillip Zimbardo, born 1933. Dr. Phillip Zimbardo, an American psychologist and professor emeritus at Stanford University, is best known for his controversial Stanford prison experiment conducted in 1971. The experiment aimed to study the psychological effects of perceived power by dividing volunteer college students into two groups, prisoners and guards. The study took place in a simulated prison environment, with the guards given authority over the prisoners. The experiment quickly spiraled out of control, with the guards subjecting the prisoners to psychological torture and abuse. Zimbardo, who also played the role of the prison superintendent, allowed the abuse to continue despite clear signs of distress among the participants. The experiment was eventually terminated after only 6 days, instead of the planned 2 weeks, due to the extreme psychological trauma experienced by the subjects. Although Zimbardo's experiment has been widely criticized for its lack of scientific rigor and ethical violations, it remains a significant and chilling example of the potential for psychological research to cause harm when not properly conducted and overseen. Conclusion. The 5 psychologists discussed in this essay represent some of the darkest chapters in the history of psychology. Their unethical practices and callous disregard for the well-being of their subjects have left lasting scars on the field, serving as a reminder of the immense responsibility psychologists have in conducting research and providing care for their patients. These notorious figures underscore the importance of adhering to ethical guidelines and ensuring that the pursuit of knowledge does not come at the expense of human and animal welfare.